And this, again, is because you cannot forecast how you will think and weigh risk and benefit in the future under circumstances that you have not yet experienced. Furthermore, advanced directives, including what's now called POLST, which is put on many of the charts on admission, cannot encompass every possible scenario. For example, a person says, I do not want to be intubated, I don't want to be on a ventilator. Okay? Let's say that individual develops pneumonia and might need to be on a ventilator for a few days or a week as the antibiotics take effect. And then could possibly live well for a year or two, should he not go on the ventilator. Now, also very much in the public mind is the idea of futility. When is it futile to treat someone? This is really difficult. There have been 3 major studies in the United States and in Britain in intensive care units and in France in the context of bone marrow transplant. And formulas have been derived, algorithms, and to predict futility. And the problem with all of these is that they might say that there's a 5% survival if you have these clinical characteristics, meaning a 95% chance that what is being done is futile. But that only works on a population level. You cannot identify which individuals are in that small fraction. And in the study from France, in some of the most desperate patients in the midst of bone marrow transplant who are septic and intubated with respiratory failure and kidney failure, there was a group that went on and lived a very healthy and high quality of life. So there is no easy answer. Sometimes surrogates are asked to help make decisions because the individual can't think for himself or herself. They may be in coma, they may be on medication, and so on. And for families, for loved ones, this is one of the most fraught and trying moments. There is, again, no easy answer, but we believe it may be helpful at such times to think about the mindset of the individual when you're making a surrogate decision. Was he or she a believer or a doubter, technology or naturalism, maximalist or minimalist, and then try to imagine as best as could be what choice that person might have made if he or she were able to choose. Now let's go to people who can think and make decisions in the context of experts disagreeing. We think it's essential to assess 3 dimensions. The starting point is your medical mind, your mindset. Are you a believer, a doubter, a maximalist or minimalist? Do you have a naturalism or technology orientation? But that is only the starting point. Then, as Pam said, you should look at the evidence, the numbers, the data, but try as best as you can to see how that applies to the individual.